Good morning, everybody, and welcome to our forum on COVID-19 vaccination for persons with disabilities. Bienvenue. My name is Megan Richards, and I am an accessibility specialist with the city's accessibility office. Joining me today is Chantal de la Plante with Ottawa Public Health and Christine Malone from the city's Equity Secretariat. Before we get started, there are a few housekeeping items to address. Zoom is still new to us, and for those who rely on supports, here is how you can access what you need. The event will be simultaneously translated into French.
Pour suivre en français, vous pouvez choisir.
If you want to follow up in English, you just have to go down and select interpretation, then French. The settings are in the bottom right corner of the Zoom screen. You will see the planet image. You will just have to choose French and put off the floor sound. The main presentation will be done in English, but you can ask your questions in the language of your choice.
Captioning in English is available by selecting the button at the bottom of your screen or through the link in the email you received to access today's forum. The link to access captioning in French is also in the email you received to access today's forum.
Le lien donnant accès aux sous-titres français se trouve.
You will have access to the French link to the captioning in French. This was included in your email.
For those who require American Sign Language, you can pin the interpreters by selecting the three dots in the upper right corner of the interpreter's video and selecting the pin icon. There are 2 interpreters for ASL and 2 interpreters for LSQ.
Et pour ceux qui ont besoin de la langue des
For the ones who need sign languages in French for Quebec, you can actually click on the 3 small dots in the upper right corner of the interpretation screen, and you just have to choose your language. We have interpreters for the French Sign Language, Quebec Sign Language. They will switch every 15 minutes. Please do pin the interpreter on your screen.
In a few minutes, we will begin the formal presentation. Presenters will share their screens, and you have the option to view the presentation in French or English. You will see on Zoom that you have a button with view options. For English, choose myself, Megan Richards. For French, choose Chantal de la Plante.
Dans quelques minutes, nous commencerons les présentations formelles.
We will start the official presentation in a few minutes. Guest speakers will be sharing their screens. Participants have the choice of watching either in French or English. On Zoom, you have some buttons for the choice of language. For French, choose Chantal de la Plante. For the English presentation, select Megan Richards.
With over 260 people currently attending, your camera and microphones have been turned off. This will assist in minimizing potential technical difficulties. We ask that all questions and comments are posted in the chat box. Our moderators will share the questions and comments when we get to the question and answer portion of our session. If you wish to ask a question in ASL or LSQ, please type ASL or LSQ in the chat box, and we will turn on your camera to sign your question to the interpreter at the right time.
Si vous avez des questions, nous vous invitons
For any questions, please use the chat box. If your comments and your question will be compiled at the end of the presentation, we will answer as the best as we can. For any questions in the sign languages, please do write ASQ if needed in the chat box, and we will activate your camera so we can answer your question.
As we begin, we would like to recognize that Ottawa and across the province, we live, work, and play on traditional Indigenous territories.
Avant de commencer, j'aimerais reconnaître qu'à Ottawa ainsi qu'à
We
travers
want to recognize that the Ottawa and the rest of the province, we are working on the traditional territory of
Ottawa is located
Indigenous
on the
people.
unceded territory of the Algonquin Anishinaabe Nation. We extend our respect to all First Nations, Inuit, and Métis peoples for their valuable past and present contributions to this land. Research shows that Indigenous peoples are disproportionately likely to experience disability in comparison to the general population. In our work to increase accessibility for all, may we be mindful of our Indigenous peoples and work to build relationships to ensure the full inclusion of Indigenous persons with disabilities. I would now like to welcome Dr. Vera Etches, the City of Ottawa's Medical Officer for Health, for some opening remarks and to provide context for our event.
Well, hello, everyone. Good morning. Bonjour, Kwe. I'm very thankful that you've made the time to join us this morning. It is important to talk about how the COVID-19 vaccine is going to be available and, of course, how the virus is affecting people with disabilities. So I'm thankful to the organizers for today, the Ottawa Disability Coalition, the City of Ottawa's Accessibility Office, and of course the members of the Ottawa Public Health Team. Thank you for coordinating this opportunity to share information and to have further discussion with members of this diverse and ever-growing community. I know that your questions are very important and also will inform the response. So as you ask questions, if we don't have an answer, it's something we'll consider and think about and use our resources to get back to you. And for me, it's always helpful to understand what the questions are so that we know what gaps we need to address. So we recognize the community of people with disabilities. It makes up almost 1/4 of our population. And it is a community disproportionately affected by the COVID-19 virus medically and relating to social impacts, the isolation, the changes to the personal supports, the concerns about mental health, among many other challenges. I want to acknowledge that there has been fear, there's been frustration that many people with disabilities and community supports, people who support are experiencing. I also want to acknowledge the strength and how much people have faced and overcome over this last year. Nous savons que la communauté des personnes en situation.
We do understand that people with handicapped people are facing, represent about 1/4 of the population of Ottawa. They are susceptible to the COVID-19 virus, and they will have other negative impacts from the COVID crisis. They have changes in the support system that they have. They've been isolated and might suffer from some mental health issues. Facing the uncertainty and the frustration because they are worried. We do understand also that we need to test for the virus within the community. Many handicapped people were infected, survived, and fighted COVID.
Accessibility considerations. And so we will have the chance to provide more information to you. And I also want to underline information guiding this program of vaccination comes from the province in terms of who, when, those questions are changing all the time. And so today we'll provide the latest information that we have, understanding that things do continue to evolve, and we need to keep working together to make sure that people in our community living with disabilities have this information. Nous avons aujourd'hui l'occasion de vous donner
Today we will have the occasion to provide you with the updated information, the information that we do have. We do understand that you have some concerns, and we're working hand in hand with the province, and we'll provide you all of the information needed as the situation evolves.
Going back to Ottawa Public Health website, there'll be updates and frequently asked questions specific to the experience of people with disabilities. So please, again, I'll hand this over to Chantal Laplante and Christine Malone and Megan Richards for the presentation, and know that I will look forward to hearing what the outstanding questions are. Merci beaucoup encore pour votre
Thank you very much for your support and your participation. Thank you.
All right, thank you so much, Dr. Etches, for your opening remarks. It's really lovely to have you here on the call and taking a little bit of time out of your incredibly busy schedule to join us this morning. So thank you so much. And without further ado, we will jump into today's presentation. As mentioned before, put your questions in the chat box, and we will do our best to get to everyone's questions at the end of the presentation. Okay, so just as it was mentioned before, the information in this presentation was last updated on March 23rd. And please keep up to date with Ottawa Public Health website for the latest, because the information is changing on a daily basis. So in today's presentation, we will cover the vaccination plan specific to the City of Ottawa. So how we are going to be vaccinating people and where we will be reaching people, how you can make your appointment, access the clinic. We will cover all of that pressing information. We'll touch on vaccine safety and approval and what you can expect when getting vaccinated. We will go over some frequently asked questions that have been compiled. And lastly, we will go over some resources that are available to you, and we'll answer your questions. So the goal of this presentation is to provide you with information on the Ottawa-specific COVID-19 vaccination plan for people with disabilities, as well as general information regarding vaccination. And the information in this presentation is based on research and evidence, and there are references at the end. So on this slide here, you can see the COVID-19 vaccine sequencing timeline. And this is the timeline that is shared by and established also by the province of Ontario. So Ottawa Public Health does not decide who is eligible when, but that decision is made based on an ethical framework. And in a context where we have limited supply of vaccine from the start and a huge logistical feat to get those vaccines into arms in the community, we are forced into a situation where we need to prioritize. And this prioritization is done with 3 goals in mind, and it's to prevent death from COVID-19 and from other illnesses as well that would be impacted by the COVID-19 virus, to prevent severe illness, hospitalization, and ICU admission, as well as to reduce community transmission. So with that in mind, phase 1 is wrapping up. We're almost at the end of March, so phase 1 is wrapping up, and we saw this week that adults who are 75 plus are now added to the vaccine rollout, which is very exciting. So we're starting to go down in age bracket, as well as adults who are chronic home care recipients. So here on the slide, it does say ineligible neighborhoods, but it's now adult chronic home care recipients in all neighborhoods across the City of Ottawa. And these are adult home care recipients through the LHIN. And in phase 2, we're going to be able to reach so many more people as vaccine supply increases. So older adults ages 60 plus will continue to receive the vaccine, and we're going to be decreasing in 5-year increments as phase 2 rolls out. And importantly, we're going to be able to reach people who live and work in high-risk congregate settings. So that includes people who live in shelters and people who live in community living. Individuals with eligible chronic health conditions will be reached in phase 2, and we will touch on exactly what those chronic health conditions are in some of the following slides, as well as caregivers of individuals with highest risk chronic health conditions. So the health conditions were were placed in 3 categories based on risk. So the caregivers of those at highest risk will be eligible. Essential workers who cannot work from home will be in phase 2, as well as people who receive direct funding for home care services. We're going to have the vaccine available in the quantity that we're able to reach so many more people in phase 2. Phase 2 is from April to July, and starting July, vaccine supply dependent, we're going to be able to reach the remainder of the population in Ottawa. It's very exciting. And throughout this vaccine sequencing and the distribution in the community, Ottawa Public Health and the City of Ottawa are continuously consulting with our community partners to make sure that the vaccine is offered in a culturally appropriate way, to ensure that everyone feels comfortable getting vaccinated in the city. And that's the goal, is to reach as many people as possible. I'll turn it over to my colleague Christine to cover these next few slides.
Thanks, Chantal. So we'll look a little bit deeper at the congregate care settings and the home care perspective and what has been outlined to date around that. So we're focusing there on our first key bullet points. So making sure that we look at developmental services, or people who are intervening on individuals' behalf, and supported independent living settings. Considering mental health and addictions in congregate settings, where we have people coming together in homes requiring special care, children's residential facilities, and Indigenous healing and wellness facilities. These all include the consideration of caregivers to make sure that they are vaccinated along with the people that they're supporting as well. You'll see that there's also an extended list of other opportunities. Some of these Chantal already mentioned, including emergency homeless shelters, the homeless population not in shelters, and looking at youth justice facilities and provincial and demonstration schools. So we are looking at very much those group living opportunities that are out there. And on our next slide that we'll move to, we're talking about a little bit more about chronic conditions. And this is how the province has identified those. So those are individuals with chronic conditions will be vaccinated in phase 2 in order of risk. And we'll talk about what that risk looks like and how they identify particular conditions that fall under the 3 categories that Chantal mentioned. So highest risk, high risk, and then those at risk. People with these conditions are at increased risk of serious illness or death, so that's why they've been prioritized as such. Essential caregivers for those in the highest risk health conditions can also be vaccinated in phase 2. So we move to our next slide. We do have a list of what that entails. So when we look at the highest risk individuals, we can see that it includes organ transplant recipients, hematopoietic stem cell transplant recipients, people with neurological diseases, which is impacted their respiratory abilities or function is impacted as well. Hemiplegic malignancy disorders less than a year, and those with kidney disease with an eGFR greater than 30. So caregivers are also accessing vaccine or eligible to access vaccine within that group as well. In our high risk group, we're looking at issues such as obesity for people who have a body mass index of above 40, other treatments causing immunosuppression, so those individuals using chemotherapy, immunity weakening medications as an example, and individuals with intellectual or developmental disabilities are also considered high risk. And if we can move to our next slide, we see a longer list for those conditions that are considered high risk. And I won't read through these in detail, but I will just highlight a few of them. So we've talked about the immune deficiencies and the autoimmune disorders, those individuals with dementia, living with diabetes, dealing with liver disease, other types of cancers, also considerations of heart disease, hypertension with end organ considerations and dangers there. Diagnosis of mental disorders has to be a consideration in this process, as well as considering those who are currently pregnant or other disabilities requiring direct care from the community. And as Chantal mentioned, now opening up that opportunity for those who receive those supports as well. And I'll turn it back to Chantal to talk more about the vaccination plan as a whole.
Thank you, Christine. So how we're going to be able to reach all of those groups in Ottawa is through these means that are here on the slide. So I'll sound it off. So we are prepared as the city to offer more than 10,800 doses per day when like in full swing of our vaccination plan. So we're going to be reaching people, vaccinating people in pharmacies, using our mobile vaccination teams through 7 community clinics, and those are set locations that will not change, and we'll cover where they are in the city in a little bit. There will be 2 hospital clinics, and eventually, not happening currently, but later down the road, the plan is to also offer vaccines in doctors' offices. So this slide here shows you the community clinics. They are not all currently operating, but they will become operational as vaccine supply increases. So right now, I believe 4 of the community clinics are operating. And you can see the 2 highlighted in blue. Those indicate our hospital clinics. So there's a clinic at the Queensway Carleton Hospital and at the Ottawa Hospital Civic Campus. We will announce broadly as clinics open, but also when you book your appointment, that's when you will get to potentially choose the clinic nearest you. And then you would have your time and your appointment location, and you would be able to go to the appropriate clinic at that time. And these clinics are all accessible. We'll share more on that in a little bit. And you can also bring a support person with you to your appointment if that's needed. And just from a physical distancing and COVID safety perspective, we are just asking to limit that support person going in the building with you to 1, if possible, but that's definitely something that we encourage you to do, to have that support. And also, I would like to add that the clinics on this slide, these are our set locations that will not be moving. In addition to that, there are several pop-up clinics. So these pop-up clinics are going in harder to reach neighborhoods where people may be more marginalized, may have difficulty with transportation, as well as other locations throughout the city. We're trying to really make the vaccine as accessible for everyone as possible. And those pop-up clinics are not on this slide because the locations are always, they're temporary, they're always changing, but they're all available on our website. And also you would know that information at the time of booking. So, sorry. Now, how will you know when it's your turn for vaccination? So, as mentioned, we're following the province's vaccine sequencing plan and vaccinating people at highest risk first. And the announcements will be shared in different ways as eligibility expands. So we're going to share that information on social media, on our website, on the local news, on television. You can also always use the eligibility lookup tool on the OPH webpage, and now also on the provincial portal as well. And if electronic technology is not familiar, you can always call Ottawa Public Health directly by phone and speak to a nurse. And our phone services are available in a multitude of different languages. So we are hopeful that we can connect with everyone there to share that information. Now, are the clinics accessible? So every single clinic, pop-up clinic and community clinic. Oh, sorry, Megan, this is your slide. I'll turn it over to my colleague, Megan, to share more about the accessibility of the clinics.
Thanks, Chantal. So one of the questions that we've been receiving quite often are about the accessibility of the clinics themselves. So these clinics were chosen using the standards of the city's facility design standards, which incorporate the standards under the Ontario Building Code and also the Accessibility for Ontarians with Disabilities Act. Site visits were done to make sure that doors had operational electronic buttons, that washrooms are fully accessible, ramps are installed when needed, and that corridors are wide enough and turning radius can be maintained. As far as on-site supports being offered, communication supports such as ASL and LSQ can be made available at the clinics upon request. We ask that you let us know at the time of booking if you require communication supports, so we can set those up in advance. If you require additional accessibility supports, we ask you to let us know when booking your appointment over the phone with OPH. We want to ensure that people are able to get to our clinics and navigate through the buildings. So these supports are available, and we ask that you just let us know.
Megan, sorry, you're on mute.
Sorry, I hit a button. For booking, there are two ways to book your appointment. To book at a community clinic that Chantal just discussed, we ask that you confirm your eligibility and then book your appointment through the provincial booking system. There is an option to book either online or by phone, and the website for this is covid-19.ontario.ca/book-vaccine. For neighborhood pop-up clinics, again, we ask that you confirm your eligibility, and you can use Ottawa Public Health COVID vaccination screening tool to check for eligibility. Once your eligibility is confirmed, you would call Public Health at 613-691-5505 to book your appointment. Booking services are available in multiple languages, and this includes the use of video relay service to book an appointment in ASL or LSQ. If you need a different language for booking your appointment, please tell the booking agent which language you need support in. More information on that at the ottawapublichealth.ca/COVID-19 vaccine website. We've been asked about booking a vaccination appointment for others, somebody in your family or friend, or if you're a caregiver. We ask that you first get the person's consent, obviously, for booking that appointment. We'll ask that, again, you confirm the person's eligibility using the online tool. You'll need their necessary personal contact information and background health information. And then you'll either book online through the provincial website or call Ottawa Public Health to book by phone. After that, you can make a note of the date, time, and location of the appointment and give this information to the person that you're helping to book for their vaccine. I will turn it back to Christine.
Yes, so we've also had questions about the power of attorney. And individuals who have the power of attorney must, if they would like to share that information, must bring it electronically. Paper copies are not required. The consent should be completed entirely, including the complete name and phone number and contact information of the individual. Should it be needed. The OPH clinics are paperless, so the consent will not be kept by OPH staff, but it's an opportunity to share that information so that all of the processes are appropriately followed. And the provincial consent form from the Ministry of Health, the COVID-19 form, can be accessed through the link that is provided, and you'll see when you get a copy of the presentation. It's COVID-19 vaccine consent form, govontario.ca. We also received a lot of questions about transportation issues. We have thought about that, and there is a transportation plan in place as well. Residents who are eligible for vaccination are encouraged to make a transportation plan to get to their appointment. Many people are accessing family and friends using OC Transpo or Paratranspo if you are a registered user. If transportation is not available for you, we can request a ride at the time of booking your appointment. A service will be provided to you free of charge, as you will be given a ride to your appointment following with all the proper COVID-19 protocols in place. There will be a designated waiting area at all of the sites for Paratranspo. So there's an opportunity if your ride arrives early or you're waiting to get picked up. Again, with the COVID-19 protocols in mind. Can I get a vaccination at home? At this time, due to the requirements of the vaccination having to be frozen, we are not able to come to a person's home to administer the vaccine. The Ottawa Public Health and the city are actively working with Ontario Health to develop a plan for chronic home care recipients that are unable to leave their homes. As we mentioned earlier, transportation and supports are available upon request to help a person get to the vaccination site. I'll turn it back over.
All right, so that's me. So hopefully that helped cover the logistic questions that you might have around getting to the clinic and booking your appointment. Now we'll change gears a little bit and we'll talk about vaccine safety and what to expect when getting vaccinated. So there have been concerns about the vaccine being developed and approved more quickly than any vaccine has ever been developed and approved. So just wanted to share a little bit of the background around why that might be. So no steps were skipped in the development, review, or approval of the vaccines. The processes that are usually followed were not really modified for the COVID-19 vaccine. The only modification is that Health Canada used a rolling review and approval process. So they started reviewing evidence around the clinical trials while they were in future phases, but then they also reviewed that evidence later before approving the vaccine. So Health Canada did an independent review of all the evidence submitted from the vaccine manufacturers and researchers, and the vaccines are safe and they work. That is why they are on market. And also they continue to be evaluated for safety and for how well they work. And they continue to be approved because they continue to be safe. So that's a really important piece, is that millions of people have been vaccinated, or hundreds of millions of people have been vaccinated around the world. And these vaccines continue to be safe and effective. Some of the reasons why the vaccine was approved quickly is because of pre-existing research on other types of coronaviruses. People were preparing for an event such as this. Researchers were prepared. There was also a lot of new technology available to leverage in order to develop the vaccine more quickly and to understand the virus more quickly. There were large financial investments put into vaccine development, so there were no financial hurdles for the developers to overcome because this was really a global effort. And then, as mentioned, Health Canada used a rolling review and approval process as well. So some of the vaccines approved in Canada. So we have in the blue box on the right, on the left-hand side, there is the Pfizer BioNTech and the Moderna vaccines. These are both messenger RNA vaccines. And then the other two vaccines that are approved, but note that they are not currently being distributed in Ottawa at this time, are the AstraZeneca vaccine and the Johnson & Johnson vaccine. And these are both viral vector-based vaccines. So these 4 approved vaccines in Canada have a lot of similarities. So for all of them, you need 1 or 2 doses. Only for Johnson & Johnson, do you need 1 dose. The other 3 are 2-dose vaccines. None of the approved vaccines are a live virus. So the vaccines, there is no possibility for them to give you COVID-19. And also Health Canada will continue to track all the vaccines for safety and effectiveness. And all of that information is public on Health Canada's website as well. So you can go and see the common side effects and see what's going on and keep track of that whole situation if you wish. So and then now that we have more vaccines on the market, there's an interesting question out there asking if people can request one vaccine over the other. So the answer to that question is no, you cannot request a vaccine over the other. All vaccines are safe, they are all effective, and which vaccine you get will depend on a couple of different factors, some being the federal or provincial guidelines for who gets which vaccine when, on the supply at the time, depending on what we're receiving, the availability at the location or in your jurisdiction or how that's distributed, as well as the storage requirements for the vaccine that you're getting. But I think the important message there is that they are all safe and they are all effective and they will all help reduce transmission of COVID-19. I'll turn it back over to my colleague, Megan.
So one of the questions we've also been receiving is if the vaccines have been tested on people with a variety of rare conditions. So our answer is that people who are immunosuppressed and people with rare conditions may not be adequately represented in all clinical trials for all COVID-19 vaccines. In general, non-live vaccines, like the COVID-19 vaccinations, can be given to individuals who are immunocompromised. There have been no safety signals of concern noted to date in the worldwide use of these vaccine products. The vaccines have been tested on thousands of diverse people in many countries before being approved. That said, if you have a medical condition and are concerned about the vaccination, we ask that you talk to your healthcare provider who will help you in weighing potential risks and benefits of the vaccination as well. In terms of medication interactions, another thing that we're frequently asked, most medications and medical conditions are not expected to interfere with the effectiveness of the vaccines. Again, we encourage people to talk to your healthcare provider if you have an autoimmune condition, if you're receiving any immunosuppressing therapies, or if you have other specific medical conditions. And again, your healthcare provider will work with you to weigh the potential risks with the benefits of the vaccination. Turn it back to you, Chantal.
Thanks, Megan. So we'll touch next on some more vaccine info. So why should you get vaccinated? So the best argument for vaccination is for you to protect yourself against COVID-19. Because there is no way to know how COVID-19 will affect you. Some people may get mild symptoms or no symptoms at all, but others may get seriously ill and could even die from having a COVID-19 illness. The best argument is really to protect yourself. And right now, we don't know if the vaccine will prevent the spread of COVID-19. We won't know that for a long time. but the main reason to get any vaccination is to protect yourself. So even if you're not able to get vaccinated at the same time as, say, the person for whom you're caring, or the reverse, if one person is covered, that still reduces the risk of illness. And just know that eventually the vaccine will be available to everyone fairly quickly. Like, we're already almost April, and starting July, it will be available to everyone. So we really urge everyone to get informed and to get vaccinated when it's available to you. So what happens after you get vaccinated? Will life go back to normal? The vaccine will not give you immunity right away. It can take up to 2 weeks after the second dose to have full immunity. So until then, we need to continue following public health measures, since not everyone can get the vaccine at the same time, and immunity is not 100%. So public health measures include wearing a mask, staying home if you're sick, maintaining physical distancing from members who are not in your household or in your bubble, and washing your hands frequently. We've been talking about these basic things for a really long time now, and this is really the best way to continue to protect yourselves from COVID-19. So what are the side effects and risks to the vaccine? So this diagram here shows the side effects ranging from very common to very rare. So very common side effects will occur in more than 10% of people. And these include pain at the injection site, having a headache, feeling tired, muscle or joint pain, fever or chills, or having enlarged lymph nodes. Common side effects occur in 1 to 10% of people, and this includes redness and swelling at the injection site. And then very rare side effects, such as serious allergic reactions, including anaphylaxis, are extremely rare. But if you suspect or you know that you have an allergy to one of the components of the vaccine, please discuss with your healthcare provider. How to manage side effects. So the vaccine side effects will go away on their own in 1 to 2 days usually. So you may feel unwell for that time. You may have a fever as well, but that is your body's natural response to building immunity to the virus through the vaccine that was given to you. It does not mean that you have COVID-19, even if you have a fever for that short little while after vaccination. You can manage these side effects by applying a clean, cool, wet washcloth over the area if you experience any discomfort. But definitely, if you're unable to do your regular activities, check with your healthcare provider. In terms of the long-term side effects, clinical trial participants are still being followed, and they will continue to be followed for quite some time still. And to date, no negative long-term side effects have been seen. The types of like messenger RNA vaccines and viral vector-based vaccines have been used before. So there is some research there that reinforces the safety of these vaccines. If someone does experience any serious side effects, please flag them to your healthcare provider or to where you got the vaccine. Health Canada tracks this information closely, and it's publicly available on their website for everyone to see. Now we'll jump into a couple of frequently asked questions that have been shared with us through the community. So one question is, why are certain people advised against the COVID-19 vaccine? So some populations were not included in the clinical trials, and that's why we can't recommend the vaccine to everyone. However, so the clinical trials, depending on the type of vaccine included people as young as 16 years old. However, pregnant women and people between the ages of 12 to 15, although they were not included in those initial clinical trials, they should still talk to their healthcare provider before getting the vaccine to go over the risks and benefits to their specific situation. And then they'll be able to make an informed decision about whether vaccination is right for them at that time. Will I need to be vaccinated every year like the flu shot? This is a good question. And right now there's not enough information to say whether a COVID-19 vaccine will be needed each year. As we learn more about the COVID-19 virus and more people are vaccinated in the community, experts will be able to determine the need for more COVID-19 vaccines in the future. At least we will have, if this is what's needed in the future, we will have learned so much from this initial rollout, and we will keep everyone posted to make sure that the vaccines continue to be offered in an accessible way to everyone who needs one. What if my second dose is delayed? So this has been pretty popular in the media lately that the National Advisory Committee on Immunization now supports delaying the second dose for up to 16 weeks for the Pfizer, Moderna, and AstraZeneca vaccines. And that decision was made because research shows that one dose is very effective at protecting against severe illness, hospitalization, and death. And by vaccinating more of the community with one dose, so giving everyone some protection, will help further reduce severe illness, hospitalization, and death and transmission, as opposed to giving 2 doses to only a smaller segment of the population. You will still get your second dose. Currently, the recommendation is for them to be 16 weeks apart. And you still need 2 doses for maximum immunity. So depending on how you book, at the time of booking, you may get your appointment for your second dose right away, or you may have Ottawa Public Health follow up with you to make your appointment for your second dose further down the road. So mental health is very important during these difficult ongoing times of a global pandemic and all the disruption that has happened in everyone's lives. So know that it's okay not to be okay. We're all, reach out and stay connected. Reach out to your loved ones, to your support networks. And we have a variety of wonderful mental health resources, some COVID-specific mental health resources available on our webpage as well. And then just a little note here at the end on misinformation. Things are changing so quickly and it can be really difficult to keep up. And there's a lot of misinformation out there regarding vaccination and vaccine safety and all of those related concerns. So just be a little critical about what you read and what you hear, because it can be hard to tell between what is true and false when we hear information in media, such as on television, on the news, on social media, on the radio, or on the phone and emails and text messages, on WhatsApp platforms. And incorrect information or false information can have severe impacts on our health. So be careful what you read and what you share, and make sure that you're going back to the source and get your COVID information from credible and trusted sources. And here on the next slide, we have these sources that we're recommending to you to get your information from. So at the local level, there's Ottawa Public Health, of course. We're updating our webpage at least once a day with the latest information The province of Ontario, so the Ontario Ministry of Health and Public Health Ontario are also good sources to get your information there. There's Health Canada, Public Health Agency of Canada, and then at the international level, the World Health Organizations, the UN, and the CDC. That's not to say that what you read in the news is false. It's just to encourage you to be critical of who is sharing the information and what the intent is behind the message. So on this slide here, we are sharing with you some of our social media and web links. If you would like to follow us, definitely our webpage is a good place to go. ottawapublichealth.ca/COVID-19 vaccine. You can also follow us on our social media platforms such as Facebook, Twitter, Instagram, and YouTube. And then there is also the City of Ottawa Accessibility newsletter that is hyperlinked on the slide, which you will have access to afterwards. And we encourage you to be a part of that as well. And just a little note here, there's an evaluation survey that we will send to you at in an email along with the presentation. And it's a 4-question, 3-minute survey that we would love to hear your feedback on. If you require accommodations to fill out the survey, then there will be a contact number at the top of the page for Megan Richards, who has gratefully offered her support to help everyone fill out the survey so we could get all your feedback. And here is our contact information if you would like to reach out to us at the end of the presentation. So thank you all so much. I'll turn it back over to Christine and Megan.
Thank you very much, Chantal. Thank you, Megan, for supporting us and providing this excellent presentation, giving us that overview of the process and some of the considerations for people with disabilities. We would now like to begin the question and answer portion of today's session. Over the last 2 months, we've been receiving and collecting questions from members of the community in regards to vaccination and the specific experience of people with disabilities. Some questions we've received were answered in the presentation. Understanding that there's still a number of questions to be answered, we are sharing the information we have to date. We will continue to share information from the province as it becomes available. We expect that more specific information will be available in April, and we'll be looking to offer another forum. Sorry, I lost my place here. As a reminder, please refer to the Ottawa Public Health website for updates, including frequently asked questions specific to the experiences of people with disabilities.
So we'd ask you to consult the Public Health Ottawa website to keep yourself up to date with what we're doing at the City of Ottawa and to find the answer to your specific questions for the disabled.
We may not have the opportunity to address all the questions, but rest assured they are being captured, so we may seek answers and share them with you following this event. We appreciate the opportunity to come together with members of the community to share information, hear concerns, and work together moving forward. Our moderators have been watching the chat of our meeting and will share some of the questions and comments that have been posted. Just as a reminder, at the bottom of your screen, there is the chat button that you can open up and see what other chat questions participants have asked as well. Please feel free to add your comments and questions there, and we are responding to them as best we can. Let's start with our first question. So I'm just going to our questions here. So one of the questions we have is, what procedures and processes need a power of attorney? Sometimes that's the case when individuals need to be able to demonstrate consent in a particular environment. So, for example, needing to show that I consent as an individual to getting the vaccine is part of that process. Okay. Another question that we have is for high-risk groups in phase 2, people with intellectual disabilities and developmental disabilities, does this include the care workers, as this was not included in the slide? Yes, we understand currently that we're waiting for more information in that area. Maybe I can ask Chantel if she has got other information on that as well.
Sorry, Christine, can you read the question off again?
For high-risk groups in phase 2, it listed people with intellectual and developmental disabilities. Does this include the care workers as it is not indicated on the slide?
So in phase 2, the caretakers of people with mental or developmental disabilities, they are not included for vaccination in the role that they play as caregivers. If the caregiver fits into one of the other categories, like for example, if they're above the age of 60, if they themselves have a chronic health conditions, then they would be included in phase 2. But because of vaccine supply in phase 2, only the caregivers of those at highest risk chronic health conditions will be included.
Thank you, Chantel. And I have another question here for you as well. It says, will this be a staggered appointment system? For example, highest risk can book appointments first, then high risk can book second, etc.
Yes, great question, and it will be. So you'll be asked to provide information at the time of booking. And on the booking side of things, we will be further, I guess, prioritizing people. We'll be asking people to book based on risk as they come available. So we'll do a call out for people, for example, who have the highest risk health conditions first. And after that is more or less complete, then those at high risk will be called for vaccination. So that everyone listed in the presentation is eligible at some time in phase 2, but not everyone can be eligible in, let's say, April of phase 2 due to vaccine supply. So yes, people will be further separated. That's not the right word, but people will be vaccinated in order of risk between April and July.
Thank you, Chantel. That's great. Another question that we have here is, what evidence is needed to prove developmental disability in order to be able to schedule an appointment as part of phase 2? Will the second appointment be scheduled when the first appointment is booked? So those are two different questions. Maybe I'll ask Chantel to talk about the booking process, if you could.
That's a great question. I don't have the answer to that at this time in terms of, to answer the question of what proof will be needed to show that you have a developmental disability or even a chronic health condition. We can take that question back, and this is something that we will surely be able to get an answer to and post on our webpage. Will the second answer the second part of the question of whether the second appointment will be made at the same time as the first? That depends on the booking method that you use, whether it's through the provincial portal or through Ottawa Public Health. It may be that you get your appointment time for your second dose on the spot, or that your second dose will be booked further down the road, and that will be a phone call from Ottawa Public Health who will follow up with you to book the second dose. But your second dose will definitely be booked, and you will be offered your second dose within that recommended 16-week interval.
Thank you, Chantel. She's so knowledgeable.
I'm gonna jump in because we
Absolutely.
have a question from someone in ASL.
Great.
So we're just promoting them so they can turn their video on. Oh. Hang on, maybe we can go ahead with the next question, and I'll work on promoting, make sure that that person can ask their question.
So we have a little bit of a question here. Pardon me while I read it. I'm a little bit confused about how one knows if a loved one is qualified, i.e. an adult on the autism spectrum, living at home and receiving supports from DSO, disability support, and MCSS, the Municipal Community and Social Services, receiving ODSP. Does this person qualify for phase 2 vaccination? And how do we demonstrate this when we try to book?
Okay. So I wish I could read the question. Can you, sorry, I'm not an audio person at all. Would you like me to read that again?
Yeah, please. Okay, so it says just a little confused about how different people qualify under phase 2. As an for example, an adult on the autism spectrum living at home and receiving supports from the MCSS, which is the Municipal Community and Social Services, and receiving ODSP, Ontario Disability Supports Program. Does this person qualify under phase 2 vaccination? And how do we demonstrate this when we try to book?
Okay, so in terms of how you demonstrate it when you try to book, that we will get back to you on. That will be posted on our webpage once we have an answer. The receiving ODSP is not an eligibility factor to include someone in phase 2. So phase 2, that person may be eligible if they are a chronic recipient of home care, if they live in community living in a congregate care setting, such as community living, if they have an eligible chronic health condition, if they're above the age of 60, if they are considered an essential worker and cannot work from home, they may be included in phase 2, and if they receive direct funding for home care services. Those are the kind of the high level people who are included in phase 2, and then we can get more specific in terms of who are essential workers and what chronic health conditions. But all that information is available either on the provincial website, on our website, or in the slide deck that you will get later. So I believe the 2 factors you listed there, ODSP recipient and the second one, alone do not make someone eligible in phase 2, but that person may be eligible under other factors if they are applicable to them.
Great. Thank you, Chantal.
Okay, we were able to promote our participant who had a question in ASL, so we'll go ahead with that now.
Daryl Hackett, you can go ahead.
For the interpreter, I don't see the, oh, thank you. Thank you. Hi, can you see me? Perfect. Good. Hi, everyone. And thank you very much for your presentation. My name is Daryl Hackett. I'm acting president of the National Association of the Deaf. And I would like to first thank all of you, Megan, and everyone from Ottawa Public Health for organizing this very important forum. I know some members of the deaf community, well, have been asking me questions through different avenues and through different platforms. And in fact, many deaf in the community, deaf members of the community do not have access to the internet.
and there's no possibility of reaching anyone to make an appointment. So, and I'm wondering about social media and newspaper. I mean, those avenues are great to dispense information. However, there are some individuals that are still struggling to get information, and I'm wondering how we can resolve that issue. Thank you.
Megan, would you like to take that one? I feel like you'd be better placed to answer that.
Sure. There's a number of ways that we're reaching out through media, through our media advisories. And you're right, Daryl, a lot of information right now is being shared electronically. But we do certainly have the option for people to get in touch with us at the city and at Ottawa Public Health to ask questions by phone. As I mentioned before, the city does have a video relay service, so people are able to communicate in ASL or LSQ. So we just ask that you reach out to us either at Public Health.
Sorry, Megan, if I can just interrupt. That's great, but to use even video relay service, you need to have internet service. And so I'm wondering how we can reach everyone. You know, there is an expectation and a desire to receive the vaccine, but I think the key is communication, and that's where the concern lies.
Sure, and I say VRS a lot, but we also have TTY available for communication with the city. But perhaps that's something that we need to do some more strategizing on. And if we're thinking about members of the deaf community who may be more vulnerable due to a lack of technology access, maybe that's a conversation we can have offline to make sure that we're reaching everybody in our communications.
Sure, that would be fine. I'm happy to set up a time to meet with you offline, and we look forward to hearing more about that. Thank you.
Thanks, Daryl.
All right, thank you for that. Going back to some more of our questions on our list here. Thank you very much, everybody, for posing all these great questions. It's wonderful to see. One of the questions is are individuals with visual impairments covered in the rollout plan? While visual impairments, sorry, I'm going to actually turn it over. I don't need to speak on behalf of this. I'll turn it over to Chantal.
All right, I'm just pulling up the list here so that I can give a proper answer. So visual impairments themselves are not included in phase 2. They're definitely included in phase 3 if that individual does not qualify under any other categories included in phase 2. But there is one of the at-risk conditions in phase 2. It's listed as other disabilities requiring direct support care in the community. So that's a pretty broad category of people. So perhaps the individual with a visual impairment could fall into that at-risk category under phase 2 if they require direct support care in the community.
Great.
But yeah, I just want to reiterate, like, I really understand that everyone wants the vaccine and everyone wants to be protected, and I completely understand and empathize with that. But we are in like a bit of a tricky situation where we have limited supply and we have so many people that we need to reach. So this framework of prioritization was really developed by the province based on an ethical framework. And everyone will get the vaccine in due time. Phase 3 will begin in July, and I just want to share that as well. Like I've said it before, but we know that everyone wants it, and we're really doing our best to make sure that we can get it to everyone as quickly as possible, but we are constrained by vaccine availability.
Chantal, I think that's a good time to mention that the province actually released just last night a document called COVID-19 Guidance for Prioritization of Phase 2 Populations for COVID-19 Vaccination. So it includes some more rationale around that ethical framework that you mentioned. And that document was just released last evening that we received at Public Health, and we're reviewing that at this time.
And we can share that in the email as well for those who want to read a pretty heavy document. We can include that with the presentation.
Absolutely.
Great. We do have a lot of specific questions around different types of disabilities and where that sits within phase 2. So perhaps we can dig a little bit deeper and also get back to some of those individual questions. For example, one of the questions that we have here is what constitutes a intellectual or developmental disability? We used Down syndrome as an example because that was what was outlined by the province, but of course that is a much broader category. So we can come back to that with some more detail around how individuals with various conditions are actually impacted as well. Okay.
And we're also expecting further information, Chantal has mentioned, from the province about phase 2. So in the last 2 weeks, we've had a tremendous amount of information that was shared to us to help in our planning for phase 2, but there is still more information that we require. And we're hoping to have that in April. We don't know a specific date at this time on when we'll receive more information, but as soon as that info is available, we will be sharing it with the public. I think we're going to do a couple of questions in French now.
Great.
Chantal, can you see those? No, I'm in the question document, but it's empty, so I'm not sure if you could. Is there a francophone who has access to the document who could read them off, or you can read? I guess they need to be read in French.
Sarah?
Yep, I can read that for you. Okay. Est-ce que les gens ayant une déficience intellectuelle et qui habitent dans les résidences
or the population living with a intellectual deficiency living in a community setting or congregated setting, will they be vaccinated? They normally are part of group 1, and the ones living in a congregated care setting is included in phase 2. And for people with intellectual deficiencies are in group 2. When we're establishing the priorities, this will be included in the document published by the province last night. It's much more detailed, and it will tell you when and how the priority was done. Right now, the information is not set and confirmed. So the situation will still evolve.
Sarah, do we have another question in French lined up?
Oui. Oh, je l'ai perdu.
Just lost it. One moment.
Je pense que ça, c'est la même question. Les intervenants qui travaillent dans les... non, OK. Les intervenants qui travaillent dans les résidences de groupe seront-ils vaccinés en même temps que les gens qui demeurent...
The support personnel will be vaccinated at the same time as the people in phase 2.
Les intervenants dans les résidences vont être vaccinés en même temps que
So
les
other support people working in congregated setting will be vaccinated during phase 2 at the same time. The only reason when I see there could be a timing difference is the following. We have to see if they're going to be eligible to be vaccinated at the same time.
I've seen a number of questions about supports at the vaccination clinics, specific to all types of different disabilities and visible disabilities. Again, it's one of those, we ask that you let us know when you're booking your appointment, if it's an invisible disability or not, what kind of supports we can provide that would be helpful to you. And those will be arranged for when you arrive at the clinic. So if a person's not able to stand in line, we ask that you let us know in advance so we can have a plan in place for when you arrive, so you're able to sit and wait for your appointment. But that includes any number of accommodations that a person might need to be able to get their vaccination at one of our sites. So please do let us know at the time of booking your appointment.
Mm-hmm.
Have time for a couple more questions?
We do. We have a lot of questions that are coming into the chat, so thank you very much. There is a bit of a lineup, and again, if we can't get to them all today, we will follow up, and we are using this information going forward to highlight some of the issues in the community and to have that opportunity for further discussion and to make sure that these concerns are addressed through the ongoing plans and the rollout that is happening. So bear with me 1 second while I look. One of the questions that we have is here, could you please define caregiver for people at highest risk? What is needed to prove when we fit into that category?
That is a great question. I hesitate to give an answer right now because I don't want to mislead anyone. So that is something that we could surely get an answer to and post on our website. That is an important detail to note, and we'll share that with you guys afterwards.
Another question I'm seeing a lot of is about proof of disability or proof of a chronic condition. We're waiting for direction on the province about how people who are included in phase 2, how they will demonstrate a condition or a disability. So as soon as that info is available, we expect sometime in the coming weeks, we'll have that available on our webpage or for people calling in asking questions as well.
And I see also a lot of questions. I'm able to open the document now, so I'm seeing them all. I see a lot of questions wondering about the certain specific health conditions and whether you are highest risk, high risk, at risk, etc. And all of those details will be in the PowerPoint presentation and in the link to the provincial website that we will share with you. And then you can go and get that information because there's a lot of disability specific eligibility questions here. And I just also want to mention before we wrap up, your eligibility, if you're eligible this week, that eligibility does not go away whether you made your appointment this week or not. So if you're eligible today and then in 1 month from now you are ready to make your appointment, you remain eligible. So it's like a growing eligibility. If you were eligible at first, we're just adding on to that eligibility. No eligibility will go away.
There's some questions about transportation as well that we can address. As we mentioned before, we encourage people who have access to transportation, their own, or with a family member or friend or paratranspo, to use those methods of transportation to access the vaccination sites. There will be designated paratranspo pickup and drop-off locations, and you will be allowed to wait inside the building for your paratranspo. If you require assistance to arrange transportation, that is available, and we ask that you let us know at the time of booking your appointment over the phone. You only have to make one call for transportation when you call to book your appointment and let us know, and then we'll actually have our transportation partners call you after that to book the appointment. So it's still just one call for booking and a request for transpo, and then we'll reach out to you to make the arrangements to get to your appointment.
You will get the same vaccine for both of your doses. The provincial tracking system will know which vaccine you got the first time. They will give you the same vaccine the second time. And in terms of availability of that vaccine to ensure that you're getting the same one, that's a logistic issue that will be managed on the city's part and on the province's part. So you don't have to worry. If you get Pfizer for dose 1, you'll get Pfizer for dose 2.
Probably have time for one more. Is there anything pressing, team?
There is a couple of logistical questions here that maybe we could just kind of end off with before we do our closing. We've had somebody ask questions and had to step away. Yes, all the questions are being captured, and because the event itself today is being recorded, we will also be sharing the links to where this recording is being housed. It'll be available on the City of Ottawa YouTube channel, as well as Ottawa Public Health channel as well. And the other question that we have is, will the presentation be made available?
Yes.
Yes, it
the
will be.
presentation will be shared with everyone in both English and French.
So we'll share all of that information in the coming days with an email to all who have registered for the forum today. We also have on the Ottawa Public Health webpage some frequently asked questions. Many of those were brought into our presentation today, but we'll continue to update those over time as we have more answers. So do keep an eye out on the Ottawa Public Health webpage for those FAQs.
I think at this point we should turn it over to give our closing remarks.
Sure. So I want to thank Chantal and Christine for your support with those questions and all of our team working today. Thank you very much to everyone who shared your questions and your comments through the chat today. We certainly appreciate the discussion and hearing the concerns and issues that you brought forward here. As we mentioned earlier, we want to acknowledge the fear, the uncertainty, the frustration that many people with disabilities, their support persons, and caregivers are experiencing. It's through forums like this that we're able to gather your feedback, to hear the really important questions, and continue to work together for more inclusive solutions. The experience and voices of people with disabilities are very important to us. The information shared today will be compiled to highlight both the concerns of the community and the outstanding questions that we still need to address. The City of Ottawa and staff at Ottawa Public Health continue to bring questions and feedback to the provincial leaders for more information and resolution.
L'information que nous avons partagée aujourd'hui.
The information shared today would be compiled. We're aware of the concerns within the community. Thank you very much for all of your questions and comments. The City of Ottawa and the personnel of Public Health Ottawa will bring these questions to the provincial health leaders. We want to make sure that all of your concerns are answered, and we want to ensure the accessibility to the vaccines to everyone in the community.
And provide more information on an ongoing basis to residents across Ottawa. Today's presentation will be shared with all participants in the coming days with a link to access a video of the event on the city's YouTube page. I'd like to say a big thank you to the Ottawa Disability Coalition for their promotion and support of this event. The engagement of community partners and residents with disabilities is essential to us in combating COVID-19 and supporting the vaccination process. Thank you to Chantel, to Zaida, to Dr. Etches, and all staff at OPH for your support for this event, as well as Christine and your team, and our technician Chris, who did all the behind the scenes work today. I'd like to also thank our French, ASL, and LSQ interpreters and our captionists today. Finally, thank you to all of our participants for sharing your thoughts and experiences, ensuring that we can move forward together.
Nous remercions tous ceux et celles
We would like to thank everyone who were with us today during the forum. Thank you for sharing your experiences and your ideas. Thank you very much to help move forward on our vaccination campaign here in Ottawa. Have a nice day.